Now, September is Gynecologic Cancer Awareness Month. The goal is to educate women about these cancers and promote early detection through screenings, leading to better outcomes for women. And Dr. Joyce Barlin of Women's Cancer Care Associates, part of St. Peter's Health Partners Medical Associates, joins us now to provide important insight. Doctor, thanks so much for coming in.
Yeah, of course. Thank you for having me.
Of course. So we know there are a number of cancers that fall under this umbrella, really. Would you just kind of identify those for us and then let us know what the most common one is?
Yeah, absolutely. So I think our take-home message for today is just about awareness. And so it's so important for every woman and their well woman exam to get every year offered a pelvic exam.
Yes.
And if their provider is concerned about cancer, then they should refer to a gynecologic oncologist. And so our specialty deals with 5 cancers, and with regard to how common they are in the population, the most common is endometrial or uterine cancer, followed by ovarian cancer, cervical cancer, vulvar cancer, and vaginal cancer.
So uterine is the same as endometrial, right? Explain that for our viewers.
Yeah, absolutely. So uterine cancer is the most common gynecologic cancer. The endometrium is the lining of the uterus that sheds with your regular menses every month. And so the most common type of uterine cancer is endometrial cancer.
Okay. So it is the most common, and I've been reading that it's on the rise. So why is that? Are there a number of factors here?
Yeah, you know, the 2 most common factors, risk factors for endometrial or uterine cancer, number 1 is age, so postmenopausal status. And the second is body habitus, so obesity, because the adipose tissue or the fat tissue in your body actually makes estrogen, and the physiology of endometrial cancer is unopposed estrogen.
And of course, they're watching the obesity one so much because we're seeing more and more individuals dealing with obesity.
That's right, and that's why they're tied together.
Yeah. So what are the symptoms here? Because I know, they can be similar in some ways generally. So can we talk about that?
Yeah, so in general, gynecologic symptoms that you should be concerned about would be irregular periods, pelvic pain, changes in bowel habits, changes in bladder habits.
We were talking about this off camera because, you want to get to this obviously before you have symptoms, right? That's always the goal. That's why those yearly checkups, going to a gynecologist, is so important. With ovarian cancer, we know that by the time you have symptoms, it's often late stage. What is the case for other gynecologic cancers? Is that true as well or no?
So I think that one of the take-home messages, especially with endometrial cancer, which we said was the most common, is that it's often caught early stage. And that's because there is an indolent period. So there's a time frame where it has not yet progressed.
Okay.
And it has symptoms that you can catch. And the most common symptom is actually postmenopausal bleeding. So for any woman that is menopausal, if they have any episode of spotting, they should certainly start by seeing their gynecologist, and then they can get referred to a gynecologic oncologist as needed.
That's an important point. Okay, so it is all about prevention here. So we've already talked about go for those regular checkups. Do not, miss those. Beyond that, what can we do? Because that's the key here.
Yeah, no, absolutely. I mean, I think in general, when you think about the 5 cancers that we treat for a prevention standpoint, the HPV vaccine has really changed the dynamic around the world. And so that's really administered to adolescents before they become sexually active. And it really needs to be recognized as a cancer prevention vaccine. And so I think that's one way to really be proactive. From an annual standpoint, it's very important, as you mentioned, for women to get their routine exams with their providers and to be offered a pelvic exam. And if they have any abnormal symptoms, to see a gynecologic oncologist.
And I know, of course, treatments vary if you are diagnosed with one of these cancers, and you obviously work with your patients to go with those individualized plans. But as you mentioned, the key here is education, making sure people are aware, and just going for those visits. Doctor, we really appreciate you coming and talking about this. Thanks so much. We know a lot of times women kind of forget about themselves a little bit.
That's right. It's time to prioritize our health. We're very good at taking care of other people, but we got to prioritize our health as well.
So true. Then we can take care of everybody else.
That's right.
Appreciate you being here. For more resources to find all of our Women's Health Wednesday segments online, go to news10.com. Look for Women's Health under the Community tab. We'll be right back.
You're watching News 10 ABC, your local news leader.